Hi, my name is Bragg, and I'm a general assignment reporter at the 19th. I'm really excited to be here with Amira Carson-Carey, who is a fellow Mississippian, a Black mama who I've been talking to for months and months and months in the midst of a pandemic, as she had a pandemic, like a COVID baby. I don't know if that's the term we're giving.
Yes.
Um, yeah, her son Imani turns 1 in April, and through this year where we have been talking about race and equity, particularly around the Black community and what that looks like through your family that has also recovered, thankfully, from COVID-19. And so I just am so excited to get to talk to you and share your story that of resilience and just that touches on so many things that as a nation that we've really come together on. And so I just would like you to just, tell us a little bit about, what how your life changed when you gave birth to Imani last April, and sort of just how quickly things changed when you found out that he had a rare heart condition.
Having a child during COVID was very traumatic. He was my second child, so the whole hospital setting was different. The whole restrictions were different. No one was allowed. My parents weren't allowed there. So it was very different. But having a child, you kind of go through the motions of just being a new mom, and that's what I did until about he was about 2 weeks old, and then I started to notice um I just didn't feel right with the way that he was breathing. Um, and thankfully, throughout this entire process, I mentioned a lot when we talk about having that network of medical professionals that I can consult, and they can say, no, we don't necessarily agree with this. That has been the backbone of why I've been able to advocate for my son the way that I have throughout this past year. And that was how we found out about his condition, just not really being comfortable with the way that he was breathing, and sending videos of him breathing to some of my friends who were medical professionals, and they were being like, yeah, he looks like he's retracting a little bit. But he never ever showed signs of being in distress. So we weren't really just alarmed. They would just, take him to the ER, they'll examine him, and if it's nothing, you guys can go back home. So, the first week of May, and I believe April, May was when COVID just spiked everywhere. Um, so yeah, we went to the ER. They had like COVID tents, like screening tents everywhere. And they were getting ready to send us back home. They was like, well, no, he's not blue. He's not showing us any signs of distress. So you guys can just go back home. And if you are anything, if he starts to, like, if his nasals flare, which is the indication of being in distress. So they came back and checked him, and just randomly, his heart rate spiked to about 230, around 230 and 250. So average age range for a newborn is 150, maybe 160, being the highest for a heart rate. So that immediately, sent red flags in. They got his heart rate to come back down, but that's when they called the cardiology team and they did the echocardiogram. And it showed that my son had 5 different heart defects. So yeah, having to hear about your 2-week-old son having, this completely rare heart condition in the ER was it was incredibly overwhelming. But from that day forward, I had time to kind of sit with it. But from that day forward, it was, what is it going to take to get him the absolute best care that he needs?
So after you find out that he has this rare heart condition that affects 1 in 10,000 children, you have this to keep monitoring his heart while you're looking for a place that will be able to do the surgeries that he'll need to live a full life. Can you just talk about particularly what that process was like as your family also was recovering from COVID that swept through your household, and that ultimately, Imani began to test positive once he arrived at the hospital that you chose?
Yes. So the choosing the hospital and the program to do his surgery was difficult because the procedures that he needed, the order that he needed was just really rare. And a lot of surgeons don't perform the surgery that he needs on babies at the time he was 3 and 4 months old. So he was really, really, really small. So they typically like for children to be, have more weight, more heavier, because that really, and I found that out after the first surgery, that really affects, the more weight they have, it really affects their recovery. So it was really hard trying to find a program. And we were going with a program. I didn't know, I just heard this is the best place for you to go. So you go there. And so at that point, I was thinking, this is the best decision. And then we get COVID. My husband got it first. He was down. Before we found out that's what he had, everyone in the house was exposed to him. The baby included, because he's 2 and 3 months at the time. So when I get it, I called the doctors here, and I was like, he was exclusively breastfeeding at that time. So I was like, am I gonna pass it to him through, So I had to distance myself as much as a 2-month-old exclusively breastfeeding mom could, and I did. I tried. I tried to make sure that he didn't, get it, because I was so afraid. He has this condition. He has these medications that he's taking around the clock. He's on the heart monitor. He wasn't on oxygen at that point. But I was really afraid that if he got COVID, it would be dire. The consequences would be dire. And I was so afraid. I cried so much because I just didn't want him to get it. And I thought that we were in the clear, because we tested positive for COVID around the 25th of June. And we didn't get to the hospital in Houston until a full month later in July. So we get to Houston, we get admitted to the ER. They decide, we're going to go ahead and admit you. So just randomly in the ER, they say, before we send you up, we're going to swab your son. And I'm thinking, oh, there's no, we've tested negative. It's been a month. And we get to the room, and I'm wondering why, like, the nurses are coming into the room with full PPE on. And I'm like, okay, maybe this is protocol. We're in another state. COVID is still, very high in Texas. So they say, well, his test comes back positive. And I was completely shattered. How did this happen? Why did it take so long for him to test positive? He's already exhibiting signs of heart failure. How is this going to affect him? How long does this mean we're going to have to put off the surgery that he needs? So there were a lot of questions, and it was very, very difficult. And it actually took him about 2.5 more weeks to test negative. The positive side to that was he showed absolutely no symptoms. It didn't have to be put on a ventilator or anything like that while we were there. We really just had to wait until he tested negative. And it was hard.
Yeah, I feel like your family just kept, getting hit with all of the disasters that we've been wrestling with and hearing stories of as a nation, and just your family it was just successive. And, one of the things, we connected was through your open letter that you had written, really trying to explain to people, to politicians, et cetera, in Mississippi about what you had been through. And, I'm going to read a little bit of it, but, I would love to, now that Imani has been through 2 surgeries successfully, he's gaining weight like, a child his age should. I'm going to read what you wrote, because I think it's really encapsulates sort of what's at the top of mind for a lot of Black mothers in this country, as we have more language to talk about sort of the inequities in the way that intersects with racism. And so we'd love to see him and and I'll read this if you want to grab him. So from your letter, you say that, quote, "I'm aware that disparities exist in healthcare, and I recognize that in many ways, Imani and I are part of a statistic that includes Black mothers that have received poor maternal care and as a result are facing an uphill battle. I now understand what it means to become a medical advocate for Imani and to harness all the resources available to make sure he has access to the best care possible to him. Regardless of my income status, his insurance coverage, or his race, Imani deserves a fighting chance.
Uh-oh.
Hi,
He
Imani.
was sleeping. So he's a little discombobulated.
I was wondering, oh wow, his cheeks are like
Let's shoot.
incredible. I was wondering if you
That
could
bed
just
head and
share.
everything.
I know, I love it. I'm wondering if you can share a little bit about how you chose his name. You know, Imani means faith, and as we talked about, and as we share in your story that's up on the 19th, is that your faith is one of the things that's been tested in this last year of his life and of your life. And so I'm just wondering, just sort of what it means to have a baby named Imani. He's almost one, yeah.
I don't even know what I was thinking. Like, if I'd have known, naming him that, we would have to go through everything that we went through. Probably would chose something else, something a little bit more calming, less stressful. I remember looking. I wanted. There's a big thing in my family for our names to kind of have a cohesive meaning. So I remember looking up names. What's the matter? I remember looking up names. I wanted him to have an African name, but I wanted it to mean something. So I really just Googled like African names and went down like the alphabet. And I made it all the way to I. I didn't see anything that I liked until I got to I, and I saw Imani, and I was like, okay. And I looked up what it meant, and I was like, okay. And my coworker is Algerian, so my first name's Arabic. My son's name, it's a different name, but I was telling her that I liked Sadiq. Raphael Sadiq was my favorite artist. And she was like, that's an Arabic name. And she was telling me the different ways to spell it. And so I asked her what it meant, and she said, honest, noble, and dependable man. So I said, that's it. That's my baby's name, Imani Sadiq. So that's how I came up with his name, just because of what it means. I didn't think it was gonna test my faith or test my just overall, drive, will to just persevere. I did not know that that's what it would mean for me, but I wouldn't change it. That whole process. I feel like everything that we've gone through, and I do believe that nothing that we go through is solely for us, but those really difficult moments that we have to experience are just tools to help someone else.
Amira and Imani, thank you so much for joining us. You can read more about their story at the19thnews.org. And I'm so happy that he was able to join us. Sorry for interrupting your nap.
Thank you for having us. It's my pleasure.